20 years ago, the World Health Organization declared tuberculosis a global emergency. Vaccinations and targeted treatments stabilised the deadly disease, but now medication shortages and the emergence of a drug-resistant strain could lead to a resurgence in TB. Papua New Guinea has been hit hard, and many tuberculosis sufferers there have a bleak future. Patients receiving treatment in developed countries like Australia considered themselves the lucky ones. Kate Arnott reports.
It's a deadly bacterial disease which is largely forgotten in wealthy nations.
One of the things that fuels TB everywhere is weakened health systems, poverty, vulnerable people.
60% of global cases of tuberculosis occur in countries in the Asia-Pacific region. Papua New Guinea is one of the worst. The World Health Organization estimates around 15,000 cases are registered every year. Of those, there are more than 3,500 deaths. Infectious diseases Dr Emma McBride spent 2 weeks in PNG's Western Province in September last year to assess TB rates. On her mission, she estimated the figures were much higher.
Not only were there vast numbers of tuberculosis-specific beds in every hospital, but almost every bed in every hospital was taken up by patients who had TB or were suspected to have TB or were very likely to have tuberculosis.
Making things worse in PNG is the emergence of multi-drug-resistant tuberculosis, which doesn't respond to the two most powerful anti-TB medications.
It's a problem because our current tools to prevent it, to treat it and to diagnose it are not adequate to control it.
Drug-resistant TB is putting a huge strain on PNG's poorly resourced health system. For patients, getting access to treatment is difficult enough. Then they have to survive 2 years of toxic treatment instead of the usual 6 months for standard tuberculosis.
Treatments like running a marathon. It's a gruelling ordeal of drugs with severe side effects, injections for at least 6 months every day, and often intolerable side effects such as nausea, vomiting, diarrhoea, even psychosis, and most worryingly things such as permanent hearing loss.
You resting? Do you sleep well at night? Or?
Yeah, fatigue is the biggest thing at the moment. Been really tired. I went back to bed for a couple of hours today.
Freelance journalist Joe Chandler is one of up to 1,200 people diagnosed with tuberculosis in Australia every year. Most people contract it while overseas. In 2011, she visited hospitals and settlements in PNG's Western Province for a series of articles about the TB crisis there.
The wards at that point were in quite poor condition, so ventilation wasn't good. They were extremely crowded. There weren't many medications available. People were very distressed and extremely sick.
A year and a half after returning home, Jo experienced fevers and violent coughing fits and was put into isolation in hospital. In March, she was diagnosed with multi-drug resistant TB. Testing since then has revealed she most likely contracted the disease in PNG. Fortunately, she's not contagious because the bug is confined to a sac around her lung.
I think I'm currently taking a mixture of about 17 or 18 pills each day, spread across morning and afternoon.
As well, antibiotics are fed to her intravenously by a nurse who visits her Melbourne home 3 times a week. Jo describes herself as a privileged TB sufferer.
The reality for the TB patients that I've interviewed and seen over the recent years has been so profoundly different to this one and mine.
Doctors say Jo will fully recover when her treatment finishes in 2 years. The same, though, can't be said for patients in PNG.
Occasionally patients will turn up to a clinic to be told there actually are no drugs available. There are other challenges as well, like people might live in a rural community but their treatment service might only be a short distance away by our terms, but if they have to use a longboat to get there and that costs money and takes a long time, then it's very hard to access healthcare.
Even getting access to affordable testing for tuberculosis in developing countries like PNG is problematic. That's why Melbourne researchers are developing a new test which may be able to detect if a patient has TB using just a drop of blood. At the moment, relatively expensive equipment is used for diagnosis, but the new test could be carried out by healthcare workers with minimal training nearly anywhere in the world.
One of the main advantages is that it is so easy to collect samples of blood from large numbers of people, including people who appear to be perfectly healthy but who may have low levels of TB, still enough to infect other people, but are not actually expressing sufficient symptoms that you would target them for diagnosis otherwise.
Increased testing is vital, but it could also expose a much deeper problem across PNG. No one is in any doubt that trying to control tuberculosis in Papua New Guinea is a big challenge, but some headway is being made. A dedicated TB ward funded by the Australian government is about to open in Daru Hospital in Western Province.
I think it's going to make a big difference. Certainly there's a change in perception about the Daru Hospital within the community. The treatment that they're doing is outstanding in Daru compared with some of the other regions.
There's also a sea ambulance which travels to patients in remote locations and training for community health workers in the province. Researchers and doctors, though, say other parts of PNG remain neglected.
It needs a lot of political will, and it certainly, of course, it needs money and it needs people on the ground.
Peter O'Neill, the Prime Minister, has recognised frequently the obstacles of the declining standards of infrastructure, the roads, the hospitals, the bridges. You can't begin to tackle TB until you deal with some of those issues as well.